Well, good morning. It is a great spring day here in Michigan in March of 2025, and we want to welcome you to our next installment of At Home with Holland Home. We're going to talk today about some care navigation and what happens here at Holland Home with residents that may need to access higher care and what kind of support we have internally to help residents and their families kind of go through that process. So, if you've been a frequent visitor to our webinars, you know that you see my face. I'm Michael Loughman, the Director of Sales here, but I'm joined by the members of my awesome team, the awesome team. They're not my team, with Selena, Victoria, and Patty all at Bretton Woods, Cindy Price at Raybrook, and I think Amy Thayer at Raybrook Manors joining us today as well. So great to have everybody on. You see my face, but it's really a great team that makes all of this happen. So um, our next event is in May, and it'll be an in-person event with a resident panel. So look for some more details on that. That's probably one of our most popular in-person events because people can hear from those that have done the move and moving in and have moved in and what that process was like. And it's always, we can talk about it from a staff perspective, but to hear from people that have actually done the move makes a big difference. So stay tuned for that. We will, we've got some things to talk about here. We will answer as many questions at the end as we can. If you have questions, if you could type that into the Q&A box, that would be great. All three of us can see it at that point. And if it gets really specific to a specific care need or something, we'll probably have to have that conversation offline. But we're here to answer as many questions as we can that make sense. But with all of that housekeeping out of the way, I'm really excited to welcome two awesome colleagues here, Jennifer and Kaye. And I'd like to maybe start with Jennifer and just, Jennifer, give us a little bit about your history and your background.
I have been with Holland Home for 22 years. I started in nursing at Breton as doing social work, and then moved over to Raybrook, also doing social work in nursing. Um, and I have been in this position, social service coordinator for independent living, for 2.5 years.
Great. So 20, you've been with the Holland Home 22 years.
Yes.
Yeah, okay. Since middle school must be. So that's great. We won't tell the employment agencies about our underage hiring. And Kaye is at our Raybrook campus, Raybrook Estates and Homes. So
Where Jennifer is.
I am.
Jennifer, I said Kaye, I meant Jennifer. So
That's okay.
Kaye's the next one we want to have introduce herself. She's at Bretton Woods Independent Living. Kaye, tell us a little bit about yourself.
Well, let's see. I guess for start, I've been here only in this role for a year and a half, although my relationship with Holland Home goes back probably close to 17 years. From the standpoint that in my previous life, I was a long-term care ombudsman for the state of Michigan. And basically what is that I was an advocate for residents that reside in long-term care settings, and I covered 9 counties, and worked with licensing, and I've been at Holland Home numerous times, and I actually retired a year and a half ago, but fortunately, Sarah, who is the executive director here at the Bretton Woods campus, told me otherwise. And I honestly have to say that given my experience and all the places that I've seen, which I was responsible for over 500 or over 10,000 people in long-term care settings, uh, I wouldn't work for another facility. So, or another community, I should say. I wouldn't put my name on it. So I'm thrilled to be here, and I love my job.
That's great. Well, we love having both of you here. And I think, Kaye, your background and the fact that you've seen all these places and we're the only place you would associate with and put your name on is a huge endorsement. So we don't take that lightly, and so we thank you for that. So
Absolutely.
so both Jennifer and Kaye are in independent living and helping independent living residents kind of navigate if higher care is needed. So we're going to talk a little bit about some of the things they have that they do. Full disclosure, when we chatted yesterday and met, I learned some things that I didn't realize they did. So this is a great learning experience for all of us. But they are in independent living, really independent living's designed to maintenance-free lifestyle. We kind of take care of all those worries, enjoy life, enjoy our vibrant living programming, enjoy just fellowship and community and being together, and enjoy some of the fun activities and things that we do. With the understanding you have access to future care. And so, and I think especially with Jennifer, having experience in working in all these different levels of care at Holland Home is so helpful, whether it's assisted living where you may need some help with, tasks of daily living, or dementia care, people with memory loss, or skilled nursing where it's assisted living is just not enough. And then perhaps, that skilled nursing where it's long-term nursing support. Our goal, and we'll talk a lot about this all through the webinar, is the goal is to keep people as independent as long as possible. So all that being said, maybe Jennifer, we'll start with you to say, how do you really interact with residents when there starts to maybe be a need, where maybe there's been some struggles and things? How do you interface with both the resident and maybe their caregiver or adult children?
I have to preface by saying there are about 380 people in independent living here at Raybrook. So there's lots of people that I don't interact with at all because they're living their independent lives and they're enjoying all the things that they have here at Raybrook. At times, people start to need more support, and we may notice that as a staff. And at that time, then I may ask to meet with the person, and I kind of investigate how they're getting their needs met. Who's their go-to person who helps them? How are they getting meals? How are they getting to doctor's appointments and getting their medications and things like that? And I am just then investigating that they're safe and that their needs are getting met. So lots of times when I meet with people, once I figure that out, then I don't necessarily have a lot of contact. Sometimes I ask to contact their adult children if they're involved with their care, just to let them know that I'm here and I'm a resource, and I give information sometimes about other levels of care in case they may need to access that in the future. So
Yeah, that's great. And that's a great point. Like there's a lot of residents you probably don't even know at all because they don't need help from social services and they're just kind of they're living their best life. So maybe Kaye, could you talk a little bit about how do you kind of get, how does a resident or adult child, how do you kind of get in the picture? What does that look like? How do you get contacted, or how do you first kind of get wind that, maybe we need a little bit of coaching here?
Well, given that we're in a community, there's a lot of different, I guess, touch points that our residents have. So it's not uncommon for us to be reached, to have another community member, another resident reach out to us and say, Mrs. Jones I saw the other day, and she didn't seem, she wasn't well dressed, or she didn't, wasn't talking like she normally had, or she was shuffling. I mean, whatever, an observation usually from a fellow resident. Family members reach out to us oftentimes because they're the ones that are much more have the hands-on, if there is an active family there, saying, hey, especially after holidays when sometimes they're spending a lot more time. And hey, I noticed that mom was repeating a lot, or mom, is in a lot of pain, whatever the case may be, whatever their concern is. So, family members reach out. We've had church members reach out. We've had, doctor's offices also reach out, to say, just to give us an update and to say that perhaps, they could help with, with some supports within their home. Again, I just want to keep reiterating is, our goal, both Jennifer's and our goal, plus the mission of Holland Home, is really to keep people in their independent living as long as possible, as long as it's safe and they can be successful there. That is what our commitment is, but also to be truthful with them when it's not safe for them to remain where they are anymore.
Yeah. That's such an important point, Kay. So Jennifer, to follow up on what Kay just said there, the goal is to keep people independent. So tell us a little bit, what do those conversations look like about home care, assisted living, skilled nursing, whatever might be needed? What do those conversations look like, and maybe when is home care great, and when is maybe that not enough?
Um, we also monitor people if they maybe have a hospital stay. There are hospital liaisons that work for Holland Home. And if we are informed that someone has gone to the hospital, they can monitor how that is going. And then we can give advice on maybe they need a short-term rehab stay in nursing. Maybe they need, we have a respite stay opportunity in assisted living. So we help people access those things if needed. Lots of people go home from the hospital with home care, and Atrio is a home care agency of Holland Home that many people use, and that helps with the transition. That home care also is usually a transition if you go from any level of care, nursing or assisted living, back to independent living, to make sure that that transition goes well and you are successful in the new environment. So we explain to people a lot how those systems work, how you access those systems, what kind of referrals you might need, and that they're available for a lot of adult children. This is not something that they've been through before. And so I spend some time giving information and explaining how insurance covers things, and what things are private pay. And
So a lot of detail of,
yes,
I think to your point, like this is something they've not done before, right?
right.
Kids haven't, the adult children haven't done this to help mom and dad. Mom and dad probably don't have that experience unless they've had to care for an older parent. So how would you say, and maybe Kay, I'll ask you this, how would you say like your experience being in facilities, and maybe Jennifer, you can answer this after Kay, like how does your experience in knowing and being in all of these places, how does that help you help residents and their families?
I think first off is like you can build a picture. I mean, the worst fear is that is of the unknown. I mean, and there's so many elements of this new journey that they're looking at in their lives. People have images of each, of what a nursing home is. Well, that might be realistic and it might not be. So I think really trying to provide them with much information and much I guess, personal observations of what it's like here on this campus, what we do, how that, each situation it's uniquely catered to, that it's not a one size fits all kind of thing. It's really that, in Jennifer and I's role, we try to help format a journey through, the aging process, through the living here, that is unique to them, and that, it removes some of the scariness, but we also are very realistic with the fact that any type of transition within a continuum of care is going to be stressful. It's a move. Moves are, it doesn't matter if it's something that you're looking forward to or if it's something that you're not looking forward to. It's stressful. And so I guess, putting in support into, managing expectations of what that is and what it is not, is very helpful, I think, in setting the platform for a transition that is, if needed.
Yeah. Jennifer, do you want to add anything to what Kaye said?
Yeah, I think both of our sort of general knowledge are from working with people with all different types of disease processes, Parkinson's, dementia, to name a few. We have a good understanding in general how people navigate through changes with that. And so we can help families anticipate what care needs might be coming in the future. And Kaye is exactly right as far as describing processes and how it's going to happen. It is very reassuring for adult children when their person is in the hospital and they know that we are paying attention to what's happening and that their person is going to have somewhere to go, that they understand, already know where that's going to be and what quality that is going to be for them. But they may not know exactly how the hospitals operate, how quickly they may be discharging someone, how the insurance might work, what the rehab stay might be like. And so she's right. I do a lot of explaining of what to expect.
Yeah.
And that just kind of helps ease the journey.
Yeah.
And if I can add,
Absolutely.
that's part of the reason why then the parents or even the individual, if they're the ones that we're working with, that's why they signed into Holland Home, that they knew that they were going to be, cared for, that they knew that, if or when that, a higher level of care is going to be needed, they knew where they were going to get it, and that, and that they were not ever going to have to look for other types of supports outside of our community. And I think that is, that has been, I've seen that as a real blessing in many ways, because, the people say, well, is there like a wait list? Well, everybody here is on the wait list for every level of care. I mean, that's the realistic, that's what I mean, now, from the standpoint, but it's just a matter of if or when they need it. Again, we're going to make sure that, like, we're going to ask the individual, what do you want? Do you want to stay in your home? Well, if you want to stay in your home, these are the things that you're going to need to make sure that you're safe and you're successful. And in our role with independent, living individuals, we just provide them with the information and the resources. It is, we don't coordinate care for them.
Right.
And that's something that, what in independent living, we coordination of care goes when somebody transitions to assisted living, and certainly into the skilled environment that we have here.
Yeah, I mean, I think the word is you help them navigate. Here's some of these next steps that need to be taken. You're going to educate them on how to do it, put them in contact with people in assisted living, as an example, so that they can have some of those conversations. We've talked a lot about, maybe your interaction with the resident. how, and maybe Jennifer will start. Okay, let's start with you on this. How do you, yes, the resident is our client, if you will,
Mhm,
but
mhm,
how do you also look at maybe the DPOA, the power of attorney, or the caregiver? How
mhm,
what's your relationship like with that, and how do you help the caregiver? Maybe it's a husband and wife, and one of the spouses is serves as the caregiver.
mhm,
How do you help support them, and how do you help support maybe adult children or DPOA?
mhm. Well, I'm going to steal something that Jennifer said yesterday when we were just talking about some of this through, and it's that it's almost you feel in some way like you're a life coach.
Hmm.
You know, and that's and that comes from what our experiences and our observations and again with the respect that there are never two identical situations. Okay. But we can certainly we kind of set the platform. When there's a caregiver, let's say, it's very hard for them that when their spouse partner is declining in some way, and the cares that they are needing, is it the most appropriate situation for the caregiver to give. There's a lot of guilt with the caregiver saying, I can't do this, I should, I've been with this individual, I promised this individual, we've been together 50, 60 years. I get that, I understand, but so I think what we try to do is that say that you are providing care for that person. Your commitment is still that. The commitment is that you are providing care to them. It might not be coming from you individually, but you are still meeting your commitment.
Hmm.
Um, we oftentimes, I mean, it's very challenging when there's when the mom or dad doesn't see their challenges and their activities of daily living, or and they're not necessarily being successful, that there are some safety concerns for themselves and or for others. Then the family or the DPOA sees it, and how to navigate that, because of course they have a relationship, they love this individual, they're supportive in their role, but what do? That's where then, I think those are the hard conversations that, Jennifer and I, have with individuals, and saying, you know, this is the reality of the situation. This is the responsibilities for each one of those entities, as well as Holland Home. We have a responsibility to, our residents, to make sure that they are, like, again, going back, and I guess I'm going to reiterate this a lot, to keep them independently, but it has to be safe and it has to be appropriate. And you know, uh, it, it it's difficult when a person doesn't recognize, or and I love it though, given my past history, I love it when somebody is fighting for their independence. Always do that, and we're going to be a fighter for that as well, but we're also going to have those hard conversations and say, well, we have to readjust how you're able to be independent. You know, in order for you to be independent, you might need to get more care. You might need to transition into a higher level of care. And these are the reasons why.
Yeah. Jennifer, you
I
want to add something?
Yeah, I think sometimes people are afraid that there's really specific cutoff type things. If you don't score well on a cognitive test, if you get this number, you're going to have to move to assisted living. Or, if this specific thing happens, then you're going to have to move. And I want to emphasize too that everybody is an individual. Everybody has different people helping them. People are allowed to fail to a certain extent. It's not one time to the hospital, now you have to go to this next place. We absolutely, if the person feels comfortable and the caregivers feel comfortable, um, going back to independent living and giving that another shot, you know, we are also, encouraging with that. And like Kaye said, sometimes it involves putting different extra care things in place. Um, and families sometimes are stepping up and providing, more observation assistance, that type of thing. So as long as we feel that someone is safe, and that doesn't mean someone's not going to have something happen in independent living, or they're going to fall or something. And but we, like Kaye said, it's like a coach. We're kind of on the sideline observing and making sure people, are getting the care that they need. And
Yeah.
if that's not the case, or if it, then we need to discuss how to get um, better care or more care. And at that point, moving on to another level care, like from independent living to assisted living, often uh, is highly beneficial for the person who's moving, because they may be um, not eating meals as regularly as they used to, and they may be starting to isolate themselves more. They're not going to quite as many activities and things that they used to. So when they do transition, um, we often see sort of a more vibrant person, come alive, from the added level of care. And that's makes me feel good, because it does show that we do know what we're talking about when we
Mhm.
think people need another level of care.
Yeah, I love the comment you made yesterday about sometimes you're more independent when you get to
Oh,
that point. You're more independent in
yes,
assisted living than you
yes,
were in independent living, because in independent
yes,
living, you had all these people coming in and trying to
yes.
help with everything.
Mhm.
Now I'm in a place where I get my meals down, you know, just down the hallway, and but I can have my privacy. I don't have somebody in my apartment
100%.
all the time. Like in many ways, you can be almost more independent in assisted living than in independent living, which was I never really thought about it like that. So I love that.
And
Uh,
if family members are providing a lot of care in independent living, and someone moves to assisted living, then family members can kind of move their role back to being the family member.
mhm.
um, and that's very nice for people too.
Yeah, that's great.
um,
What other kind of resources do you help with people? So maybe it's not even care navigation or
Mhm.
what have you, but what other kind of resources do people come to you with help that they need help with? Kay, sorry. Kay.
That's right. But
Yeah, sorry.
I think it varies. I mean, it's a big spectrum, if you will. But some of the things that we also deal with is that what about their planning, advanced directives, durable powers of attorneys, have they been put into place? Because these are the big things. If there's a situation, whether it be permanent or temporary, where somebody cannot make their own decisions, there needs to be a decision maker that is being put into place, and having that planned for, and the documents completed prior to, an event. We work with people to ensure that they are set in place and they're the correct, they're correct. Um, we talk about, do not resuscitate. Making sure that they have their preference or their choice, um, um, you know, put in there if they want to be resuscitated, if they don't, that they understand what that decision is. I mean, really, our thing is I think, both Jennifer and I, we really want to give them information so they can make an informed decision. It is
Mhm.
not our decision; it is their decision. And so that's why we are very, I think, we're advocates for them to make sure that in the event that they are not able to make a decision, that their decisions will be made. I'll give a personal example. I mean, I had both of my parents had the advanced directives, and I was their durable power attorney for healthcare and for finance. But um, making those decisions as a DPO when all of a sudden somebody can't. I mean, there's a lot of emotions. I mean, that's just plain and simple. But that was the biggest gift that they gave me was the document outlining basically what they did and they didn't want. And then also, basically, respected the fact that they were giving me that choice or that responsibility. I looked at that and I had to utilize both of those documents. And it was the biggest gift because I didn't have to make decisions. I didn't have to question, am I doing the right thing? I basically what they gave me the privilege to do was to honor their decisions, and that was I can never thank them enough for that. So I think sharing those kind of things and making sure that those resources or those documents are put into place just for being respectful of their decisions and what their quality of life, what they deem that is. So that's an important document. The other things that we do, I mean, there's outside meal opportunities, bringing resources in, tap into whether it be Meals on Wheels or the other types of, meal delivery types of services. So again, to keep them in their home and that they are being provided with, adequate diet, transportation services. I mean, it goes on and on. I mean, again, the questions are, as we age, we need to utilize resources that we haven't had to tap into. So what do? You start asking people and from our background, we've seen a lot of resources and things that are, out there that are beneficial, but we're continuing to learn because as the community and the society is, recognizing different needs, we're able to really enlighten ourselves as well as other opportunities that we can support, and that can be of support for our residents that we provide services to.
Yeah. Jennifer, do you have anything to add to that?
People ask questions sometimes about how their insurance works. People ask questions about like the call buttons for safety. And so we are a resource, and I can give them information about different companies that do that, different ways that they do that. And to Kaye's point, things are changing, and one of the newer things, they have watches and things that can monitor people for falls and for safety and that type of thing. And so, and I've even had some families utilize cameras and things. And so basically giving people ideas and options and information about resources, transportation, that type of thing. If they're no longer driving, what are some ideas of things I can do or I can use?
So, I mean, realistically, people on this webinar, they could stay in their home, right, and never move to Holland Home. And they could try to figure out all of this when I'm getting discharged from the hospital. Where am I going to go? I need some help with advanced directives. As a caregiver, I need some coaching. I mean, I could try to figure all that out, right? Or I could come to Holland Home and have you, Kaye, or you, Jennifer, be that, help me navigate, be my life coach, be my resource. I mean, gosh, I think I need to get on the wait list personally. Like I need to, I need that team approach because to what we've talked about, like this is something people have not navigated, right? They haven't tried to access assisted living likely, or skilled nursing, or what does it mean to age and I can stay in my home, but what kind of helps are there? So So you provide a lot of services. So tell those are maybe Jennifer, either one of you, what are your rates to provide these services to residents?
Our particular position, there is not any separate charge whatsoever for accessing my knowledge.
So what I'm hearing is free life coach, free navigator, free resource. Like that was the point, right? I knew the answer to the
Right.
question. So,
Yes.
so yeah, I mean,
Mhm.
what a great resource to be able to tap into that, you know. So, before we open it up for questions, anything either one of you want to add that maybe we should have touched on, or something you want the people on the webinar to know?
Hmm. I guess there's so much to know, about the aging process,
Yeah.
and I think the biggest thing is that I think of support of the benefits of being in a continuum of care such as Holland Home, specifically Holland Home, but from my perspective, is that you know you're as independent as you possibly can be. You can be engaged as you want to be, or not engaged, but you always have a touch point. You always have a department here that if you have a question, we might, Jennifer and I might not have the answers, but we will certainly do our best to try to figure it out and to give you a referral out to another agency or to another thing. And I think too, I want to make sure that when we refer out, provide our supports, we provide the supports that are available to people outside of our Holland Home community. So I don't want people to think that we're just saying, we only give a trio services referrals, and that's not what we do. We truly are committed to them being a part of not only our community here, but the bigger community, and to keep that. I mean, we have a lot of activities, that individuals participate in. That are not specifically on the campus, that some that are transportation is provided by Holland Home, some not, but or just the arrangement of it. So I think that is something very unique about our campuses. And to your point, there are some people here. I think there's 600 people on the campus or in our from the Bretton Woods. Isn't that about right?
Yeah.
And I some of them I've never met. Or I met a long time ago. I met even in my past life, if you in my past job.
Yeah.
I've known. And I think the benefit of this, and we touched on this yesterday, is that you're going from one community. Our communities have changed. Our neighborhoods have changed. The ones that are of my parents. And the parents before that, we take care of ourselves. We take care of our neighbor, and that is something that I think is a beautiful thing about this type of a continuum of care. That you might not know your neighbor, but you care enough about the neighbor. If the neighbor, there's something going on, that how can I get that support? Because that's the kind of community that we are in. Those are the communities or the neighborhoods of days past. And that's lovely to see here. And many new friendships, relationships, support systems are given within that your neighbor.
Right.
And that's beautiful.
Yeah.
That's really I love to see that.
Yeah. The residents really do look out for each other, advocate for each other. And so, Jennifer, was there anything you wanted to add?
I think from seeing more of independent living, I I guess I didn't fully understand what a benefit it is to be in a community like this. The the to have in the building, all the um, social, opportunities. There's daily coffee time. People exercise walking the halls. There we have regular exercise, and then all the different activities that you know um, add benefit to people's lives. I feel um, being here can prolong your quality of life.
Mhm.
I just really I see it,
Mhm.
and I just feel really strongly about that.
Yeah.
It's really neat to see, and we do have a lot of people who do take care of each other, neighbors
Yeah.
who watch out for each other, and um, it is really a beautiful thing.
Yeah. That's wonderfully said. And as we look for questions in the Q&A box, if you have questions, I think one of the other things that we see here is that are my neighbors in independent living. And when I have to go to a higher care, or maybe my health has changed, I have to go to a higher care. A lot of times my neighbors come with me, right?
Mhm.
Oh,
So
yeah.
I end up being in
Mhm.
Raybrook assisted living or Bretton Woods assisted living. And guess what? My neighbor that was next down the hall from me at Bretton Ridge
Mhm.
is down the hall from me now. So
Mhm.
so there's still that community when it could be a
Mhm.
little harder to form community. So I think that's also one of the blessings there.
Well, and you know what? I think the thing is your neighbor, if you're in independent living, or if you move, transition to either, assisted living or skilled, given what your needs are, what's appropriate. I mean, visitors, I mean, and visitors, they still go over. I mean, many I've had in the past, clearly going up to assisted living, their neighbors, we've always had coffee, and so they go and they visit each
Mhm.
other. You know, as as much as they can. So I mean, those relationships are established, and they're not terminated once you move to your transition to another care. I mean, it is the sense of community.
Yeah.
They follow individuals. Those friendships aren't based on just being next door.
Right. Certainly the proximity makes a big
Mhm.
difference. So
Right, right.
um so we have a couple questions. Please keep them coming. Martha asked, we're on the waiting list for Holland Home at Breton, but we might like a tour of Raybrook if possible. Yeah, absolutely. Just Martha, work with your salesperson at Breton, whether it's Victoria or Patty, and they can kind of help facilitate connecting with Raybrook. So no worries there. Next question. How does one initially engage with the social services team? How does that first touch point happen? I know we talked about this a little bit, but maybe just how does the ball get rolling? How do you get engaged? Whoever wants to answer, sorry. Yeah,
Go ahead, Jennifer.
My turn.
yeah, yeah.
um, uh, I, Nate and I, the director of independent living, after people get settled here, we do a visit and sort of introduce ourselves, introduce our role. Um, uh, Kay and I's role are a little bit different in that my role, I also help manage the health center here. And so then I also explain to people what kind of opportunities and services that are available through the health center. Um, Otherwise, people call, um, adult children call. We have a little magnet system, says social service coordinator on it, and other, really specific numbers for people to try to access any information that they might have. And then I do reach out to residents individually if if there's a concern. And then if, I get permission, then I also reach out to families.
Yeah.
So.
Because I think the main point is the residents, unless the DPOA has been activated, the residents in control.
Mhm.
And
Absolutely.
so they're
Yes.
still calling the shots of who's going to
Yes.
be engaged and who's not. So
And I think to further that, I mean, even if the DPOA has been activated, I think, if I could speak for Jennifer too on this too, hopefully, that it's not that the feelings or the choices or the desires or whatever of the resident are negated.
No.
We still keep them very much in part. I mean,
Right.
and that, help process and help identify, from their standpoint, what their choices are. And we really help to try to facilitate and navigate those choices with the family or the DPOA, who or the decision-making power that be. So, even after activation, it doesn't mean that individual we don't recognize as let's focus on what's best for this individual and what their choices and how we can help continue to support them in a manner in which they would want.
Mhm. So this next question from Sheila, I don't know that I completely understand it. So maybe I'll do. Given the comment, there is a wait list for every level of care. What if one transfers to a higher level of care and it determines one's needs are better met at a lower level of care? How does that affect fees? Um, do, Jennifer, I mean, you flinched, Jennifer, so I think I'm going to call on you.
We do have times when, say, a person is needs assisted living or maybe even needs dementia assisted living, and their spouse is still in independent living. You pay your monthly fee for independent living, and then you pay separately the fee for assisted living for just the one other person. And the fees in assisted living are based on the level of care need that you have. And assisted living does have a more structured assessment of people to put people in levels of care in order to determine payment. So if you do not need as much care, you are not going to pay as much as someone who maybe needs more care.
Okay. And if somebody was in higher care and their care needs change and they don't need as much care, they're gonna be
Yes,
they would move. Look, I
yes,
don't
they do change the love. Yes,
yeah, it's not like once I'm in
both ways.
assisted living or what have you.
Right.
Sometimes it's just a stop there to get better so I can get back home, right?
That's
Yes.
A
right.
lot of
That's,
I mean, a lot of people go to assisted living just temporarily,
Mhm.
oh yeah.
right? And then just to come back home. I shouldn't say
That would be a respite care,
yeah, right.
I mean, a respite situation. Yeah. I mean, and as a matter of fact, this week somebody has been in the skilled level for, I think, 3 years now, and she's moving to assisted living because and so it again, this is it's the process, the transitions are individualized. It's not a matter of like what you said,
Right.
once you move that you can't move, or this is where you have to. No, we are constantly reevaluating and again, helping the person to be in a less restrictive, living arrangement that possibly can be successful in. So, that's just a proof of point right there that,
Yeah.
everybody's unique and there isn't a one stop shop. That's it.
Right. Well, and I think that's the perfect example, I think, that addresses Sheila's comment is that they were in nursing and
Mhm.
they've improved, they can go to
Mhm.
assisted living, their
Mhm.
rates are going to go down.
Mhm.
I think it also says, guess what? Holland Home has skilled nursing, where some of our competitors or peer communities
Right.
have done away with skilled nursing.
Right.
So I think that's a big important point. If we're talking about a continuum of care, we still have skilled nursing, and
Right.
where our peer communities don't. So
Right. You're right.
um,
I think on this campus too, it is a huge benefit for people, if they're maybe both not mobile, super mobile, needing a walker and that type of thing, and one person is in assisted living, the other person does not have to go outside to go visit their person. It's a big deal.
Yeah.
Um,
Patricia asked, this is a statistic. I don't know if you know the number. What percentage of your residents remain independent until their death? In other words, that they don't access higher care. Do you know the percentage?
Well, I mean, yeah, I don't know that here, but I mean, just given, we have what, 30, well, on this campus, we have, let's see, I think we have 44 beds at our 45 beds at our in the skilled slash rehab, and we have 45 beds, um, for our assisted living, and we've got 600 and, so I mean, I think the percentage here, again, we're lucky to have our sister campus,
Right.
Raybrook, that that has a much larger bed count or room count for assisted living. And I don't know how many how many skilled nurse. I should know from my past life. I should know how many beds skilled and rehab that you have, Jennifer. I don't know.
I believe it's about 90. I believe it's about double what you have. But I can't tell you the number for assisted living, but that is a big number because there is regular assisted living and then there's dementia care assisted living.
Yeah. We have 236 assisted living beds at Raybrook.
Oh, there you go.
So at Raybrook, we take a lot of outside admissions from the community. I think the point is, and Patricia, I commit to you, we'll get that percentage because I know that's something my boss will know. The number of people that don't.
I do say, I was in a meeting recently and they were talking about the average stay in assisted living compared to 5 years ago. And the average length of stay is much shorter now than it was 5 years ago.
Yeah.
Which to me says that people are staying in independent living longer.
They are.
So if that sort of answers the question.
Our average length of stay in independent living is about 10 to 11 years. That's our average. There are people, on both sides of that, obviously. But assisted living, I think people are waiting till there's higher acuity to come in. And so there's been more of a turn in assisted living. So, but Patricia, I'll work with your salesperson to get you that percentage because actually it's a good percentage for us to know. So
please share that with us too. That would be good.
Oh, absolutely. Yeah. I won't be double secret with it. I'll let you know.
Okay.
So Doug asked, could you both live in the same apartment when one needs assisted living and the other just independent living and pay only the difference of care as appropriate? I don't know I don't know if this means like two people go to assisted living, one's really independent, but one needs assisted living. If that's the question, then yes, I mean, people do that. Someone would be kind of a level one where their spouse may need higher care. So level one is just it's a much lower rate.
Right.
Your food's included. We have situations where that's the case. Otherwise, people do what we talked about earlier, where somebody stays in independent living and somebody's in assisted living, typically same campus, right? And so then they can visit, and sometimes the person that's in assisted living will visit the person in independent living, goes back to the apartment for a while, maybe during the day, and then goes back to assisted living. So hopefully that answers your question, Doug. Did Kaye or Jennifer, you want to add anything to that? Okay. How do you help facilitate conversations between family members if the adult child thinks a higher care level is needed for someone currently in independent living, but the resident doesn't believe it's needed yet. Tell
Often.
us about those yeah, great question.
We do have difficult conversations. I guess the way that I explain it is that with the care agreement, Holland Home does have an obligation to make sure that people get the care that they need. Um, and so we do our best to work with residents and with families and make that happen. But there are times when we have the hard conversation um, uh, about someone needing a higher care level that they may not think that they truly need. But like I said earlier, um, we try to work with families and try to give different ideas about how someone may be able to stay in their apartment if they get extra care in, something like that. Um, and, you know, we're trying to avoid someone obviously, having something catastrophic happen. But people are allowed to fail. But there is a limit to that.
Right.
Is that
Yeah, that makes sense.
so? There are some hard conversations, but usually we can work through them and come to some type of consensus.
And I know I've talked to adult children that are in this exact situation of what our question was, where we become the bad guy with the adult children's blessing, so that that relationship between the children and their parent, the resident, can stay intact. And we become kind of the heavy of the kids are really on the same page as us, but we become the heavy. And so we can be the bad guy to help preserve peace in the family. I know you both have done that. I know that for sure. So, so, Sheila asked, how many Medicaid beds does Holland Home have?
Well, Medicaid beds, both of the campuses for the skilled level, they're what we call duly certified. So that means that they take Medicare and Medicaid. I mean, so, but I guess more of that is that they can bill both of those entities, for that. So it's the Medicaid beds, as far as for skilled, it's a matter of that comes in when the current funds are they can no longer pay private pay. So then they transition to Medicaid. In assisted living, they're really typically Medicaid does not cover that cost. But that doesn't mean, but that's also then where then the benevolence comes in from the Holland Home. That's the continuum of care promise. So, Jennifer, you want to add a little bit more?
Yeah. In assisted living, there's 5 levels of care. If you are a level 1 through 3 and you have run out of funds, that's when the benevolence, when Holland Home helps supplement that to help you stay in assisted living. If you get to a level 4 or 5 and run out of funds, they will ask you to transition to a long-term care bed or a nursing bed and apply for Medicaid. If you're at a level 4 or 5, you are close to a nursing level of care. So that it kind of overlaps.
Yeah.
So they're not asking you to move when it isn't a care level that you actually need. And it is quite unique that in the level 1 through 3 that they help keep you in assisted living.
Yeah.
And that's quite amazing. And so in the end, everything kind of gets worked out. And that's what I try to explain to people. There's some intricacies to it, but in general, things get worked out.
Well, that's the benefit of having this continuum of care, the promise. I mean, that no matter what your level of care, where you're at, what your needs are going to be met at the appropriate level of care and the appropriate setting.
Right.
And
Yeah.
in independent living, that is managed by yourself and your family members. So Kay and I do not manage people's care in independent living. We are more of a resource and guidance and coach.
And so, going back to the question, the number of beds, especially for Holland Home residents, is not even, it's immaterial, because if the resident needs the care, they're going to get the care.
Right.
And it will depend on if they're on, if they've outlived their resources or not. So it's more about, first of all, we have skilled nursing for them to access. And second of all, that we guarantee that that they will be cared for. And people on the floor, they don't know who's getting benevolence.
No.
They don't know who's getting benevolence. There's probably less than a handful of people here that know who gets benevolence, because it's immaterial. You're going to get the care regardless if you're a Holland Home resident, regardless if you've outlived your money. So
correct.
We've approached an hour, and so I'm going to kind of wrap things up here. We had a question at the end. They joined late. No worries. This will be loaded on our website probably by the end of the week. You'll get an email reminding you with a link. I can't thank Kay and Jennifer enough for their wisdom and sharing their experience, and hopefully everybody on the webinar gets a sense of how residents here are looked after, and what great resources we have in people like Kay and Jennifer. So again, our next event's in May, in-person event, but we've got some fun things planned for this year, so stay tuned. And until next time, this has been At Home with Holland Home, and we hope you have an amazing day. Take care, everybody.